One vitamin is being studied by scientists around the world for its role in arterial health, and most people have never heard of it. The research is still emerging, but early findings are interesting enough that major researchers are investigating further. You've probably been told about cholesterol, blood pressure, and exercise. Those things matter. But here's what newer research is revealing. There's a vitamin called K2 that works in your arteries in ways that are completely different from what we've focused on for decades. Most doctors haven't even learned about it in their training yet. And that's not because it's fake. It's because the research is relatively new. Today, I want to walk you through what that research actually shows, honestly and clearly. Think about someone you know, maybe a family member, who did everything right for their heart. They watched their diet, exercised, and their cholesterol numbers looked good. And then something unexpected happened. You might wonder, was there something more they could have done? Or maybe you're thinking about yourself and wondering if there's something important you're missing. Well, there might be. But I want to be honest about what we actually know and what we're still learning. Hi, I'm Dr. Livia Carter. I've spent the last 10 years helping people understand their health better, not just reacting to problems, but actually preventing them when possible. Today, I want to talk with you about vitamin K2 and what research is showing about its role in cardiovascular health. Now, I'm going to be transparent with you. This isn't a proven miracle solution. This is emerging science. But it's real science. It comes from legitimate research institutions, and I think it's important you know about it. So let's walk through this together, and I'll show you exactly where this information comes from. Over the next several minutes, I'm going to introduce you to vitamin K2, what it is, why researchers think it matters for your heart, what the actual studies have found, and what that means practically for you. I'm also going to be clear about what we know for certain and what we're still investigating. By the end, you'll understand the current state of the research, and you'll have real information you can discuss with your doctor. We're not talking about hype, we're talking about actual science. Here's what you're going to walk away with. You'll understand what K2 is and why scientists are interested in it. You'll know what the research actually shows, the real findings, not exaggerated claims. You'll learn where K2 comes from and why most people might not be getting enough. You'll understand how this fits into the bigger picture of heart health. And you'll have specific resources, actual studies, that you can look at yourself or share with your doctor. You won't feel confused. You'll feel informed. Understanding vitamin K2 and arterial health. Let me start with something that happens in all of our bodies as we age. Calcium deposits can build up in arteries. This is called arterial calcification. Now, calcium in your bones is good. You want strong bones. But calcium in your artery walls, that's a problem. It makes arteries stiffer, narrows them, and restricts blood flow. This process is associated with increased risk of heart disease and stroke. Here's where K2 becomes interesting. In your arteries, there's a protein called matrix GLA protein, or MGP. Researchers have discovered that this protein has a specific job. It helps prevent calcium from depositing in arteries. But, and this is important, MGP only works effectively when vitamin K2 is present. Without adequate K2, this protein doesn't function properly. What's encouraging is that this isn't theoretical. This mechanism has been demonstrated in laboratory studies and in cell research. We understand how it works. The question researchers are now asking is, if we optimize K2 in humans, does this actually prevent arterial calcification and improve cardiovascular outcomes? And early evidence suggests it might. Now, I want to be careful here. Knowing how a mechanism works in cells is not the same as proving it prevents disease in people. That's an important distinction. But it's a starting point for understanding why K2 matters. Some of my patients ask, so if K2 does this in the body, why isn't my doctor recommending it? That's actually a fair question. The answer is, the research is still emerging. Most large medical organizations haven't made K2 a standard recommendation yet because we don't have enough large-scale human studies showing definitive outcomes. But that doesn't mean the research isn't real or valuable. It just means we're still investigating. What the actual research shows. Let me tell you about some of the actual research. There's a major European study called the Rotterdam Study, conducted in the Netherlands. Researchers followed thousands of people over many years and looked at their vitamin K intake, both K1 and K2, and tracked their cardiovascular health. The study, published in 2004, found an interesting association. People who consumed higher amounts of K2 had lower rates of cardiovascular death compared to those with lower K2 intake. Now, here's the important part, and I want you to really hear this. This finding is an association. It means the researchers noticed that higher K2 was connected with lower cardiovascular risk. It doesn't prove that K2 caused the lower risk. Why? Because people who eat more K2-rich foods might also be healthier in other ways. They might exercise more. They might eat better overall. They might come from higher socioeconomic backgrounds with better healthcare access. You can't separate out all those variables with just observation. Despite this limitation, the finding was significant enough that it prompted more research. Scientists around the world started investigating K2 more carefully. Studies came out looking at arterial calcification directly, measuring whether higher K2 levels were associated with less calcification. And generally, they found positive associations. There have been several peer-reviewed studies examining K2 and bone health, particularly menaquinone 7, which is one form of K2. Some of this research is more solid because bone density is easier to measure accurately than cardiovascular outcomes. The findings suggest K2 helps regulate where calcium goes in your body, toward bones, away from arteries. That's promising. But I want to be clear, we still don't have large, well-designed, randomized controlled trials showing that giving people K2 supplements prevents heart disease. Those are the gold standard studies, and we haven't done them yet on a large scale. That's why major organizations like the American Heart Association and American College of Cardiology haven't made K2 a standard recommendation yet. When you hear that the research is promising but not conclusive, does that make sense to you? Can you see why scientists would be interested but also want more evidence before making strong recommendations? This is actually the responsible way science works. We find something interesting, we investigate, we gather more evidence before making claims. It's not always as dramatic as scientists discover cure, but it's how real progress happens. What I find encouraging is that the research on K2 is growing. More studies are being done, more scientists are interested. It's not a dead-end topic, it's an active area of investigation. The mechanism, how K2 works at a cellular level. Let me explain the biological mechanism in simple terms, because understanding how something works gives you confidence in why scientists think it matters. When K2 enters your cells, it activates certain proteins. One of the most important is that matrix GLA protein, MGP, that I mentioned. This protein, when activated by K2, essentially acts like a traffic controller in your arteries. It tells calcium, "You don't belong here, move along." It helps prevent calcium from accumulating in artery walls. There's another protein involved too, called osteocalcin. This protein helps direct calcium toward bone tissue, where you want it. K2 also activates this protein. So K2 is essentially working to keep calcium in the right places, bones, teeth, and out of the wrong places, like arteries and soft tissues. Laboratory studies have shown this mechanism quite clearly. When researchers add K2 to cells, these proteins activate. When K2 is absent, they don't. This isn't speculative. It's been demonstrated repeatedly. Now, again, cell studies are not the same as human outcomes, but they give us confidence that K2 is doing something real at the biological level. It's not magic, it's biochemistry. Patients sometimes ask me, if this works at the cell level, why don't we see massive health improvements? And the answer is, because your whole body is complicated. There are many factors affecting your cardiovascular health. K2 is one piece of the puzzle, not the whole puzzle. Where K2 comes from. Now let's talk about where K2 actually comes from and why most people might not be getting enough. Vitamin K2 is produced naturally, either in certain foods or by bacteria. In foods, K2 is primarily found in animal products and fermented foods. The best sources include aged cheeses, particularly hard cheeses like Gouda, which is studied specifically for K2 content, grass-fed butter, egg yolks, especially from pastured chickens, fermented foods like sauerkraut and natto, which is a Japanese fermented soybean product, and meat, particularly organ meats like liver. There's also a form of K2 that your own gut bacteria can make from K1, which is abundant in leafy greens like spinach and kale. But this conversion is variable. It depends on your gut health, your medications, and your individual biology. The good news is that K2 is in foods that are delicious and accessible. You don't need to eat anything strange or unpleasant. You just need to make some deliberate choices. Now, here's where the modern diet comes in. Over the past several decades, dietary guidance told people to avoid full-fat dairy, limit eggs, and eat less meat. Some of that advice had good reasoning. But one consequence is that many people dramatically reduced their intake of foods that contain K2. At the same time, industrial farming practices have reduced K2 content in animal products because animals are eating grain-based diets instead of grass. So, on both sides, less consumption of K2-rich foods and less K2 in the foods themselves, most people today are probably getting suboptimal amounts of K2. K2 versus K1. Why the distinction matters. Let me clarify something that confuses a lot of people. Vitamin K has multiple forms. There's K1, phylloquinone, which is in leafy greens and its primary role is blood clotting. Then there are K2 vitamins, menaquinones, which have different roles. The most studied forms of K2 are MK4 and MK7. K1 and K2 are not interchangeable. K1 goes to your liver and helps with clotting. K2 goes to peripheral tissues, your arteries, your bones, your cardiovascular system. They're different molecules doing different jobs. This distinction is actually important and reassuring. If you're on a blood thinner like warfarin, your doctor might monitor your K1 intake because K1 affects clotting. But increasing K2 doesn't have the same effect. So you can work on K2 without interfering with blood thinners, though you should definitely tell your doctor you're doing this. This is also why just eating lots of spinach and kale doesn't necessarily solve a K2 deficiency. You're getting K1, which is wonderful, but it's not the same as K2. If you want K2, you need to get it from the specific foods that contain it. What research says about practical outcomes? So, beyond the mechanism, what does research actually show about whether K2 helps people in real life? There are some studies on K2 supplementation, particularly with menaquinone 7. One study published in Nutrition, Metabolism, and Cardiovascular Diseases looked at K2 supplementation and bone health outcomes. Researchers found that supplementation was associated with improvements in bone mineralization. Again, that's a promising finding, but it's one study. There's also research from cardiologists showing that people with higher K2 intake have less arterial calcification when measured by CT scans. This is observable, measurable change. But is it enough to prevent heart disease? We're still gathering evidence on that. What's encouraging is that we're not finding harm. Unlike some nutrients where more is not better, K2 seems to have a clear benefit signal with no obvious downside in the ranges people are consuming from food. One important thing researchers are looking at now is whether K2 supplementation, not just getting it from food, actually prevents cardiovascular events. That's the gold standard outcome. But those studies take years and are expensive. We're in the waiting phase for some of that data. Does it make sense to you that research can show promise at multiple levels, mechanism, cellular studies, associations, even some supplementation outcomes, but still not have conclusive proof of disease prevention? That's kind of where we are with K2. And that's okay. It's actually the appropriate position for science to take. We're interested, we're investigating, we're being careful about what we claim. But that doesn't mean you have to wait for perfect studies before considering K2 in your diet. Getting K2 from real foods is safe and nutritious, regardless of what future research shows. Cheese, eggs, and real food. Let's talk about some specific foods, because this is where theory meets practice. Aged cheeses are the most studied for K2 content. Gouda is particularly high. It can contain 75 micrograms of K2 per ounce. Edam, brie, and other aged cheeses also contain meaningful amounts. Now, I'm not saying eat unlimited cheese, but a small serving, an ounce or so, a few times a week is reasonable food, and it contributes to your K2 intake. Egg yolks are another interesting story. They've been demonized for decades because of cholesterol concerns. But egg yolks contain K2, plus a whole package of beneficial nutrients. Some research on eggs and cardiovascular health shows that whole eggs, including the yolk, don't negatively impact cardiovascular health the way old dietary guidance suggested they would. In fact, some studies show they can be part of a healthy diet. So if you enjoy cheese and eggs, this is actually good news. You don't have to eliminate them. You just need to include them thoughtfully in an overall healthy diet. Grass-fed butter is another good source. Fermented foods like sauerkraut are excellent and have the added benefit of supporting gut bacteria. For people who eat meat, including organ meats occasionally, liver, for instance, provides K2. The point is, K2 is in foods that are accessible and that people actually enjoy. You don't need specialized supplements or strange ingredients. I have patients who say, "This is great because I've been avoiding these foods thinking they were bad for me, and now it turns out they're actually good?" That perspective shift is valuable. It's not about adding more restrictions. It's about rediscovering that some foods you thought were forbidden are actually nutritious. The bigger picture of heart health. Now, I want to be really clear about something important. K2 is not the whole story of cardiovascular health. It's one piece of the puzzle. The bigger picture includes several things working together. First, physical activity. Moving your body regularly is foundational. You need cardiovascular exercise, strength maintenance, flexibility. All of it matters. Second, overall diet quality. Plenty of vegetables, reasonable portion sizes, limiting processed foods, good quality protein sources. K2-rich foods can be part of this, but so can lots of other things. Third, stress management and sleep. Your nervous system and your cardiovascular system are deeply connected. Fourth, managing your weight and blood pressure if they're concerns. Fifth, staying socially engaged and mentally stimulated. And then, within nutrition, K2 is one nutrient among many that matters. Vitamin D, magnesium, other B vitamins, omega-3 fatty acids, these all play roles too. What's nice about understanding K2 specifically is that it fills a gap. You might be doing lots of things right for your heart, but if K2 is missing, you're missing one important piece. On the flip side, if you optimize K2 but ignore everything else, you won't see the full benefit. So think of K2 as part of a comprehensive approach to cardiovascular health. It's not either or. It's also. Should you get tested or supplement? Some people ask, can I test my K2 level? The answer is technically yes, but practically, most people's doctors can't easily do this test. K2 testing isn't standardized the way cholesterol testing is. Some specialized labs can measure it, but it's not commonly available. Should you supplement with K2? That's a question for your doctor, particularly if you have any health conditions or take medications. Some people do take K2 supplements, and they're generally safe. But there's a difference between supplementation and just including more K2-rich foods in your diet. Food is always preferable when possible, because it comes with a whole package of nutrients, not just the isolated supplement. The practical approach is this. If you want to optimize K2, start with food. Make deliberate choices to include more K2-rich foods in your diet. See how you feel over several weeks or months. If you want more specific guidance, talk to your doctor or a nutritionist. If you do decide to supplement, that's a conversation with your doctor. They can advise on dosage, timing, and whether there might be any interactions with medications or supplements you're already taking. They can also help you monitor whether it's having the intended effect. Putting it all together, your practical path. So let's say this information resonates with you and you want to do something. Here's how I'd think about it practically. First, understand where you're starting. Think about your current diet. Are you already eating aged cheeses, eggs, fermented foods? Or are you starting from scratch? That helps you identify what's realistic to add. Second, make small changes. Maybe it's adding a bit of good cheese to your meals a few times a week. Maybe it's including eggs in breakfast more regularly. Maybe it's trying sauerkraut or other fermented foods. Pick things you actually like. Change that's sustainable beats perfection. Third, talk to your doctor. Bring this information if you want. Ask them about your cardiovascular risk factors. Ask if K2 is something they think is worth addressing in your situation. They know your health history and can give personalized guidance. Fourth, give it time. You're not looking for immediate dramatic changes. You're supporting your body's health. Over time, this contributes to better cardiovascular function. What I love about this approach is that you're not waiting for a medication or a perfect solution. You're taking action now with simple food choices. That sense of agency, doing something meaningful for yourself, is valuable in itself. And remember, the research on K2 is promising, but it's still developing. You're not taking a huge risk by including more K2-rich foods. You're just eating nutritious whole foods that happen to have this nutrient. That's good for you regardless of where the K2 research ultimately leads. Here's what I'd love to know. What was the most interesting thing you learned in this video? Was it about the mechanism of how K2 works? Or was it learning that cheese and eggs might be good for your cardiovascular health? Or was it just knowing that this research exists and is being actively investigated? Drop a comment and tell me. Your comment might help another viewer understand something they needed to hear. And if you decide to make changes based on this, if you start including more K2-rich foods or talk to your doctor about this, come back and tell me how you're doing. Real experiences help other people get clarity. I want to be completely transparent about something. Everything I've shared today is based on peer-reviewed research, but it's educational information. It's not personalized medical advice. The research on K2 and cardiovascular health is promising and real, but it's still emerging. Major medical organizations haven't yet made K2 supplementation a standard recommendation, which means we're still in the investigation phase. Your situation is unique. You have your own health history, your own medications, your own specific risk factors. Your doctor understands all of that in a way no video can. If you have any cardiovascular concerns, if you take medications, if you have any health conditions, please discuss K2 and these ideas with your doctor before making changes. They're the one who can advise you properly on what's right for you specifically. Think of this video as helping you understand an emerging area of research and asking better questions. Your doctor is your guide for your individual care. That's the appropriate path. In our next video, we're going to talk about something that might surprise you: the hidden sources of inflammation in your body that even your regular blood work might not catch. We're going to talk about simple markers your doctor can test for, what they actually mean, and practical ways to bring inflammation down. Because inflammation is increasingly understood as a major driver of heart disease. It's going to change how you think about heart health. Make sure you're subscribed so you don't miss it. Here's what I want you to take with you. Your heart health is not something that just happens to you. You have more influence over it than you might think. Understanding nutrients like K2, making good food choices, staying active, managing stress. These are all things you can control. Heart disease is serious, and I never want to minimize that. But the encouraging truth is that much of it is preventable. The research on K2 is one example of ongoing discovery about how to protect yourself. Science is always learning more. You've got this. Your health matters, and I'm honored to help you understand how to protect it. Thank you for spending this time with me. I'll see you in the next video. Take care of yourself.